Okay. Good evening, all. Today I am going to present human immunodeficiency virus. AIDS, acquired immunodeficiency syndrome, is a syndrome caused by a virus called HIV, human immunodeficiency virus. The illness alters the immune system, making people much more vulnerable to infections and diseases. HIV is found in the body fluids of an infected person. The virus is passed from one person to another through blood to blood and sexual contact. In addition, infected pregnant women can pass HIV to their babies during pregnancy, delivering the baby during childbirth, and through breastfeeding. HIV is a virus which attacks the T cells in the immune system. AIDS is the syndrome which appears in advanced stages of HIV infection. HIV is a retrovirus that infects the vital organs of the human immune system. The virus progresses in the absence of antiretroviral therapy. Now, next, we'll move on to structure of HIV. HIV is an enveloped RNA virus. As HIV buds out of the host cell during replication, it acquires a phospholipid envelope. Protruding from the envelope are peg-like structures that the viral RNA encodes. Each peg consists of 3 or 4 GP41 glycoproteins capped with 3 or 4 GP120 glycoproteins. Inside the envelope, the bullet-shaped nucleocapsid of the virus is composed of protein and surrounds 2 single strands of RNA. 3 enzymes important to the virus life cycle. They are reverse transcriptase, integrase, and protease are also within the nucleocapsid.
Visually, please. Visual.
Pardon, sir? Hello?
हेलो स्लाइड इतनी शार्प नहीं दिखाई दे रही है प्लीज विजुअल
Next is life cycle of HIV. Once HIV binds to a host cell, the viral envelope fuses with the cell membrane and the virus's RNA and enzymes enter the cytoplasm. HIV, like other retroviruses, contains an enzyme called reverse transcriptase. This allows the single-stranded RNA of the virus to be copied and double-stranded DNA to be generated. The enzyme integrase then facilitates the integration of this viral DNA into the cellular chromosome. Provirus is replicated along with the chromosome when the cell divides. The integration of provirus into the host DNA provides the latency that enables the virus to evade host responses so effectively. Production of viral proteins and RNA takes place when the provirus is transcribed. Viral proteins are then assembled using the host cell's protein making machinery. The virus's protease enzyme allows for the processing of newly translated polypeptide into the proteins, which are then ultimately assembled into viral particles. The virus eventually buds out of the cell. A cell infected with a retrovirus does not necessarily lyse the cell when viral replication takes place. Rather, many viral particles can bud out of a cell over the course of time. Stages of HIV life cycle: binding, fusion, reverse transcription, integration, replication, assembly, budding, antivirals for each stage. Takeaway. Symptoms of AIDS. The symptoms of HIV are the results of infections caused by bacteria, viruses, fungi, and parasites. These conditions do not normally develop in individuals with healthy immune systems which protect the body against infection. Many people with HIV have no symptoms for several years. Others may develop symptoms similar to flu, usually 2 to 6 weeks after catching the virus. The symptoms can last up to 4 weeks. Typical symptoms include fever, chills, joint pain, muscle ache, sore throat, sweats, particularly at night, enlarged glands, a red rash, tiredness, weakness, and weight loss. In many cases, after the initial symptoms disappear, there will not be any further symptoms for many years. During this time, the virus carries on developing and damages the immune system. This process can take up to 10 years. The infected person will experience no symptoms, feel well, and appear healthy. If left untreated, HIV weakens the ability to fight infection. The person becomes vulnerable to serious illness. This stage of infection is known as AIDS. Symptoms of late stage AIDS may include blurred vision, diarrhea, which is usually persistent or chronic, dry cough, fever above 37 degrees Celsius, lasting for weeks, night sweats, permanent tiredness, shortness of breath, swollen glands lasting for weeks, weight loss, white spots on the tongue or mouth. During late stage HIV infection, the risk of developing a life threatening illness is much greater. Examples include esophagitis, that is an inflammation of the lining of the lower end of the esophagus, infections to the nervous system, that is acute aseptic meningitis, subacute encephalitis, peripheral neuropathy, pneumonia, some cancers, sarcoma, invasive cervical cancer, lung cancer, rectal carcinomas, head and neck cancers, cancers of the immune system known as lymphomas, toxoplasmosis, a disease caused by a parasite that infects the brain. It can also cause disease in the eyes and lungs, tuberculosis, etc. Diagnosis of HIV. Diagnosis is made through a blood test that screens specifically for the virus. After infection with HIV, it can take up from 3 weeks to 3 months for the virus to show up in testing. Retesting may be necessary. ELISA, that is enzyme-linked immunosorbent assay, is routinely used to test for HIV. Treatments for HIV AIDS. Currently, there is no vaccine of cure for HIV AIDS, but treatments which can improve patients' general health and quality of life are available. Anti-HIV medication called PEP, post-exposure prophylaxis, may stop infection. The treatment should be taken as soon as possible after contact with the virus. HIV is treated with antiretrovirals. The treatment fights the HIV infection and slows down the spread of the virus in the body. HIV treatment is usually permanent and lifelong. Antifungal cream, cephaloporax, may help to eradicate HIV. According to some limited studies, mineral or vitamin supplements may provide some benefits. Research for vaccine development is underway. Thank you, everyone.